Hello, I'm a general pediatrician who helps children with ADHD and other learning disorders. Over the past many years, I've helped hundreds of families with these challenges. And while I was doing a search over the internet and YouTube to see what kind of resources are out there for the general public, I found that there's actually a relatively lack of professional advice on this topic. A lot of it is testimonial from people who have ADHD themselves, but there's not a lot of professional opinion, so I decided to make this video. And if you're watching this video, maybe it means that you've been diagnosed with ADHD yourself, or maybe your child or children have ADHD that's been diagnosed by a medical professional. So what is ADHD? First of all, ADHD stands for Attention Deficit Hyperactivity Disorder. There are three general categories of ADHD. The first type is called inattentive type. This is for people who generally get distracted but who are not necessarily hyperactive or always impulsive. The second type is called ADHD predominantly hyperactive impulsive, and as the name implies, this involves individuals who have problems staying still, and even if their mind is even if their body is able to stay in one place, but their mind sometimes starts racing and get this sense of restlessness when they're either in school or attending a meeting. And the third type is called combined type. This is when you have characteristics of the previous two types. And I want to mention that in the upcoming DSM-5 coming out later in 2013, the categories may change. This is the new way psychiatrists and medical personnel are looking at ADHD and different types. Another common question I get asked is, what is the difference between ADD and ADHD? Well, ADD turns out to be an older term that's been retired by the medical and scientific community back in the 1980s. So ADHD is the current modern term, but ADD has been used for so many decades by the media and the general public that it somehow got stuck in the consciousness of the general public. The way ADHD is diagnosed is that it typically involves a long interview with a doctor that's backed up with a set of questionnaires from the parents, from the teachers also, and there's scoring scales from these questionnaires that can be done to characterize the severity of the symptoms. And the symptoms of ADHD must manifest before the age of 7, and it must last more than at least 6 months. Otherwise, there may be other factors that may be contributing to the symptoms and may not actually be ADHD. And the set of symptoms must happen in more than one settings. So, for example, either at school, at home, maybe it's with homework. At school, maybe paying attention to the teacher, getting classroom work done, getting things turned on time. Or in the work setting, maybe it's missing deadlines or forgetting meetings. But at the end of the day, the most important thing is that ADHD, in order to be diagnosed with ADHD, the set of symptoms must make your life hard in some way. If it doesn't really interfere with your life, you do not have ADHD, because many people will argue that we have some ADHD in all of us, because we can all relate to the experience where we sometimes find ourselves distracted in a meeting, or find ourselves mind wander when we're doing something that we don't find particularly interesting. But if it doesn't make our lives hard, then it's not ADHD. So now, the way I see ADHD is that I don't typically like the term disorder, because I see it more like as a personality. ADHD is part of your personality, and that also implies that it is a lifelong condition, because you don't necessarily change to a different person by the time you reach a certain age. It's always going to be a part of you. It's part of who you are. At the same time, it certainly makes things hard, but it can be beneficial in other ways, because some people find that it helps them get things done because they're particularly motivated, and they're very energetic and they're very enthusiastic. And some people think that ADHD gives them additional creativity because it allows them to think in non-linear ways. So now, if you're watching this video, one of the most important thing is you want to know, well, now you have ADHD, or you've been diagnosed with ADHD, what can you do about it? There are many things that can be done. First of all, just having a greater understanding that it's ADHD and not something else. It is not because it's laziness. It's not because of lacking motivation. It's not because you're simply bad, or it certainly doesn't imply anything that has to do with intelligence, because some of the brightest people and some of the brightest kids I've worked with have ADHD. And no doubt in my mind that, in the future, if one of my patients end up on the front page of the Time magazine, it's going to be one of my patients with ADHD, because these kids can be just extraordinarily creative and motivated. So having greater understanding is very helpful, especially for parents and teachers, because then they're more capable, more willing to work with these kids in helping them overcome the challenges that comes along with ADHD. And there are other behavioral and social environmental changes that could be done to help the children with ADHD. At home, I would say, well, doing homework is perhaps one of the greatest challenges for children with ADHD. When these students come home, I would recommend to do homework first. This is before turning on the TV, before getting on to going outside and play first. When you come home, take a 10-minute break, use the bathroom, drink some water, take a snack. Don't overeat, because that can make you groggy. But literally set a timer for 10 minutes, and once the 10 minutes is up, get to homework right away. And always do homework at the same spot every single day. And on the desk, there shouldn't be any distracting objects. The computer, if it happens to be on the desk, should be off. Radio should be off. TV should be off. Ideally, you try to turn the phone off too. So there shouldn't be any sort of distracting objects on the table. On the table, there should just be whatever that's necessary to accomplish the homework, and nothing else. And get to homework right away. And as far as how long the homework should take, there's actually a general rule of thumb. There should be about, this is actually the official definition by the American Educational Council, is about 10 minutes per grade level. So first grade, 10 minutes, second grade, 20 minutes, third grade, 30 minutes, and so on. This is deemed a reasonable amount of homework. And now I know a lot of parents will complain right now that their homework is generally way too long, and there's no way to finish within a reasonable amount of time according to the standard. But that at least gives you a general guideline. I would say certainly a second grader who takes 4 hours to finish a homework assignment is way too long, and in my opinion, that's just cruel and unusual punishment, and there's probably some problem going on if it does take that long. So other things that you can do at home is you can make lists. So for example, one of the other challenges that I often hear from parents is that just simply getting ready in the morning can be very difficult. The child often finds himself distracted, in the process of brushing teeth, and you forget to wash the face, or forget to put the homework in the backpack, and while eating breakfast, and you forget to comb your hair. So having a regular routine and having that written down on a list, maybe put that list on the mirror of the bathroom, can keep the child on task and remind what is next. And so you have to be very specific, and list can be extremely helpful. And as far as what could be done at school, there's something called a 504 accommodation. The 504 accommodation name comes from Section 504 of the Rehabilitation Act of 1973. This is a federal law that's designed to help children with additional challenges in the classroom setting. One thing I want to make very clear is that 504 accommodation is not the same thing as special education. A lot of parents are afraid that when they ask for special help from school, their child will be assigned to the special educational classroom, and they don't want that to happen. And so the 504 accommodation is not special education. It's simply done in the same classroom, same as everyone else. In fact, this is specifically listed in the law, the body of the law, that the educational environment must be the same. But additional accommodation is made for the student so that the student can get things done. To me, for example, it's maybe seating the student near the teacher in front of the class versus toward the back, where there are a lot more distraction if you seated toward the back. Or maybe it gives you additional time to complete tests or homework assignment. Maybe making the deadline more flexible for certain projects can be very helpful too. And another thing I want to talk about is grade retention. Being retained in a grade is very devastating, and it's detrimental often to the self-esteem of a student. So for children simply with ADHD and not other additional challenges, being retained in a grade is usually the wrong thing to do. It usually does more harm than good. So I'm usually against the idea. I will try to do everything possible to avoid this from happening. But unfortunately sometimes it's necessary, because if you simply haven't mastered the material, forcing the child to move on to the next grade can occasionally cause even more problems. But this is not my usual route, and I would say let's usually do everything possible before we consider grade retention. As far as the medication treatment, no doubt, most of you have heard that there are medicine out there for treating ADHD and helping people focus better. A lot of parents approach the topic of medication with great trepidation, and I completely understand that, because the idea of medicating your child on a long-term basis is indeed a very scary proposition. So I'm here to say that, well, medication, while they're not perfect, they can be tremendously helpful. And don't take my word for it. Just talk to other families and friends, or families in your classroom, your child's classroom, what other parents experience. They can be tremendously helpful, but they're not completely side effect free. There's certainly side effects associated with the medication treatment, and a lot of parents are very concerned about these. And I want to clarify that the medication, while they do have side effects, they're very safe. They're not dangerous. They will not cause any damage to your child's the brain, the heart, kidney, liver, spleen, any internal organ. There's no long-term side effects, and we know this because these medicines have been used for more than 60 years, so they're not new. And I want to go over some of the most common side effects. By far, the main side effect associated with the medication treatment is that these medicines in general tend to suppress your child's appetite. So when your child is taking the medicine and the medicine is in effect, he or she may be less hungry. And this is most noticeable for lunchtime, but occasionally it can extend into dinner time. So I would say don't stress out too much about lunchtime. Make sure your child gets a big and nutritious breakfast. And lunchtime and dinner time, try to push the dinner time later if possible. And if that's not possible, I still encourage the child to have dinner with the rest of the family and have a late bedtime snack after dinner. And that's the time when the child is most likely to feel hungry. And as a result of this side effect, monitoring weight of the child is extremely important. I take that as my #1 priority, is to ensure that the child continues to grow and thrive properly. The second most likely side effect is actually a lot less common than the appetite suppression side effect, is that for some children it can take them longer to fall asleep. This is not nearly as often, doesn't happen nearly as often as the appetite side effect. But in some cases, some children who are particularly sensitive to the medicine, it can take them more than an hour to fall asleep. And that definitely becomes an issue, because the next morning you still have to get up and get ready for school. I keep an eye out for the side effects, but I typically don't have to worry about the side effects nearly as much as the appetite suppression. And the third side effect is that sometimes it can make your child more irritable. What I mean is, maybe he can be more emotionally sensitive. One of the examples I use is that, if your child forgets to tie your shoelaces, normally you just mention that you forgot your shoelaces are untied, and he would just reach out and tie the shoelace and don't make a big deal out of it. But if the medicine makes you more sensitive, then he may cry. He may say that nobody likes me anymore, and so this is the side effect that I'm least tolerant of, because for me it really infringes on the quality of life for the child. So if it makes you sensitive and irritable all day, it is unacceptable to me. So if this ever happens, I typically have to change the treatment and change the medicine altogether. And occasionally, some people, when they first start medicine, at first, for the first couple of days, they can experience some headache and some queasiness in their stomach. But these side effects tend to be very short-lived. They rarely last more than 3 days. And they're also grounds for changing treatments too. And lastly, a lot of parents are concerned that maybe their children will become addicted to the medicine. Well, I want to say that first of all, I have never seen this as a problem, and I know that because usually it's the child who comes to me and proposes to stop taking the medicine for some period of time to see whether they still need to take the medicine. And I'm all for that. If monitored carefully with the supervision of a medical personnel, this is a problem that I never encounter. And usually I recommend at least giving the medicine a try, because I have seen so many just tremendous success stories. They literally change lives around. And the end goal of the treatment is always for the child. We should never lose sight on this, because the goal is to make the life of the child easier. It's not to appease a teacher's demands. It's not to make the parents' life easier, even though that could be a nice side benefit. But we should never lose sight that we're trying to improve the quality of life of the child. And going back to the diagnosis, if your child does not have any challenges in life due to these symptoms, then he or she simply does not have ADHD. And just being diagnosed means that their life is impacted in some negative way. Then in this case, we should do everything possible to make the life better. And one last thing I want to mention about the medicine is that the dosage of medicine is never based on the age, the height, the weight, or the severity of the symptoms for ADHD, for that matter. This has to be found out empirically. So you basically have to go through a period of trial and error to find what is the dosage that works for your child, what is the right medicine. Each person responds to the medicine differently. There's clearly no one medicine that's that's better and better tolerated, has less side effect than the rest of the medicine. Every child behaves differently with the medicine. We do have to monitor side effect very carefully, but our end goal is to find a medicine and a dosage that works. And this process it can take months or occasionally up to a year, and it can be quite frustrating. It can really test your patience, but my experience is that it's worth the wait and it's worth a try, because at the end of the day, your child can be much happier, be more confident, and more willing to try new things. Thank you for listening.